So we're going to talk about, my disclosures. I do speak for this company, but Kaiser keeps 90% of my money, so I'm not really that conflicted. But let's talk about why we're even talking about augmentation. We know that patients who have rotator cuff repairs do well, but we also know that there's a high incidence of rotator cuff re-tears. And we also know that the patients who heal their cuffs do better. They have better quality of life scores and they have better strength components. So everything we do, we strive to do with rotator cuff repairs is to get the tendon to heal to the tuberosity. When we look at where the failure happens, it's at the suture tendon interface. That's the weakest length of the construct. So all of our efforts should be focused to strengthen that interface. And one of the best ways to do that, in my opinion, is using the acellular dermal allograft, which is Arthroflex. It has greater than 97% of the DNA is removed from the dermal allograft. It can be stored at room temperature. It's biocompatible. Over 100,000 of them have been implanted without any reported incidents of inflammatory response. I've personally implanted over 1,000 of them in different parts of the body. I've never had a problem or rejection or infection or a reaction towards it. It retains its native collagen scaffold, which allows for host cell infiltration and can assist in healing. What I love most about it is the ability to retain suture. So I pass sutures on either end of it, and I have my resident pulling on the dermal allograft as hard as he can, and it just cannot rip the suture out of it. So it provides a lot of strength. Another reason I love it is because it integrates very quickly. This is a case that was nicely shared with me by Misty Suri. Used a dermal allograft on a partial thickness cuff tear. At 6 weeks after the surgery, the patient fell, had an additional injury, required reoperation, and you can see how well and nicely and quickly